Thank you, Dr. Chabra, for the introduction, and thank you, NDPF, for giving me this opportunity and time to tell you something about the young heart attack. 15 जुलाई सुबह 10:15 पे एक एम्बुलेंस मैक्स हॉस्पिटल की इमरजेंसी के अंदर आती है और एक 25 साल का इंजीनियरिंग स्टूडेंट अपनी मां के साथ कोलैप्स स्टेट के अंदर पैरामेडिकल स्टाफ उसको लेके जा रहा है इमरजेंसी के बेड पर. वी ट्राइड बट वी वर नॉट एबल टू सेव हिम. मां बिलक बिलक के रो रही है, डॉक्टर साहब बचा लो इसको तो कभी बुखार तक नहीं हुआ था. आप क्या कह रहे हो? ऐसा नहीं कि हमने कोशिश नहीं करी, हमने कोशिश करी, बट द एनिमी was so deep that we were not able to save him because it was extensive anterior wall MI और जो 2 दिन से उसको पेन हो रहा था and ultimately he collapsed. और माँ बोल रही है, डॉक्टर साहब अगले महीने तो इसकी शादी है, कल ही इसकी शादी के कार्ड छप कर आए हैं, and now instead the family is preparing his funeral. This is what the India is facing, the epidemic of young heart attack. The scenario these days is it's not the son who is bringing his father to the emergency, but it is the father who is bringing his son and daughter to the emergency for the management of heart attack. ये तब नहीं था, ये उस समय नहीं था जब हम मेडिकल कॉलेज में थे. At that time the heart attack generally occurs at the age of 55 years, but in the year 2025, 20 to 25% of the heart attack generally occur less than 40 year of age. Less than 40 year. And the median age in India is about a decade earlier than the Western counterpart. हम लोग, we are producing the largest number of widows in the world. Why? There is a study that called Inter-Heart Study and the CREATE study that has shown clearly that non-traditional risk factors like lipoprotein little a, hsCRP, metabolic syndrome, substance abuse, anabolic steroids, they are more commonly responsible for the heart attack in a younger population. But strikingly, 20% of the heart attacks is risk factor negative, that is, they don't have any hypertension, diabetes, smoking. So what is the reason? Is it a chronic stress, social disconnection, or a sleep cycle disturbance? So let me find out what is the reason. Let me tell you what is the reason I have found. The most important is double burden. We Indian are sandwiched between the genetic predisposition to a smaller coronary arteries to the worst of western lifestyle, जिसके अंदर हम फास्ट फूड खाते हैं, वेपिंग करते हैं, स्मोकिंग करते हैं और लॉन्ग सेटिंग करते हैं. सेकंड, आपके स्ट्रेस का ओवरबर्डन. हमारी जो यंगर जनरेशन है, यूथ, वो प्रेशर कुकर के अंदर है बिकॉज जॉब इनसिक्योरिटी, फाइनेंशियल बर्डन, टॉक्सिक रिलेशनशिप्स, डोपामिन एडिक्शन वाया रील्स और मोस्ट इंपॉर्टेंटली फोमो, फियर ऑफ मिसिंग आउट. ये जो कल्चर है इसके अंदर, इसकी वजह से स्ट्रेस के अंदर है हमारा यूथ. थर्ड, फिटनेस ट्रैप. फिट आउटसाइड, सिक फ्रॉम द इनसाइड बिकॉज ओवर ट्रेनिंग, डिहाइड्रेशन, सब्सटेंस अब्यूज, टेस्टोस्टेरोन इंजेक्शन, स्टीरॉइड यूज, अनरेगुलेटेड प्रोटीन अब्यूज और क्रैश डाइट विथ नो फैट. दिस ऑल आर कार्डियोटॉक्सिक. It's not a cardioprotective. And most importantly, I want to tell you one thing, that is silent killer. What is silent killer? A lipoprotein little a. It is inherited independent of LDL marker which is responsible for many of heart attacks. Indian metabolic combo, fatty liver, PCOS and early onset diabetes. ये 2 silent killer हैं जो हमारे youth को, हमारे young generation को खाए जा रहे हैं. How many of us ordered lipoprotein little a? We are not ordering lipoprotein little a. Only few of us are ordering lipoprotein little a जब हम उनको investigate करते हैं. And lastly but not the least, it is the delayed presentation and delayed recognition. डॉक्टर साहब, I am too young to get heart attack. फैमिली का आदमी बोलता है, डॉक्टर साहब ये तो बच्चा है, इसको हार्ट अटैक कैसे हो सकता है? और एक क्वैक आता है साथ में, अरे इसको कुछ नहीं है, इसको गैस की प्रॉब्लम है. So this is what we are having so much number of heart attacks. और अभी कर्नाटका के अंदर आपने देखा होगा 20-25 बच्चे हार्ट अटैक से गए. लोगों ने बोला ये तो कोविड वैक्सीन का है। जी नहीं, ICMR clearly says that 90% of heart attack in younger population is because of the lifestyle, it's because of the genetic predisposition, it is because of the metabolic dysfunction. So don't blame the vaccine, blame what you are eating, what you are ignoring, what you are postponing. Let me give you one formula. It's called HEART, heart. H means early health checkup. Early health checkup. Don't wait till the age of 40 years. Get your lipid profile, get your ECG, get your blood sugar, get your BP number, get your lipoprotein little as early as possible, even at the age of 25 years if there is a strong family history. E stands for exercise. Exercise के बारे में बोलूंगा तो exercise smartly, do in a moderation, don't overdo. अगर आपको करना है, do aerobics, do yoga and do strengthening exercise for your sanity, not for the vanity. Acknowledge your stress, because chronic stress जो होता है, that is directly linked to coronary artery disease, because chronic stress lead to endothelial dysfunction and ultimately you land up in coronary artery disease. R means real food. Eat what your grandma ate. No crash diet. No to white poison, no salt, no sugar, no processed food, no maida. And lastly, T, time is your muscle. Whenever anybody is having chest pain, left arm pain, jaw pain with breathlessness, don't Google your symptoms. Don't call your gym trainer. Go and rush to the hospital and get a certificate that I am not having a heart attack. India. Let me tell you one thing. India is losing its youth, not to a war, not to an accident, but to a disease which we were trained to detect, but are we detecting it on time? Or we still are stuck up in our old textbooks कि 50 साल या 55 साल के बाद ही हार्ट अटैक होता है? जी नहीं, we as a doctor have to update our clinical radar, because आज का acute MI, आज का youth वो smart watch पहनता है, उसके 6 packs हैं, they sip green tea, but inside their coronaries is tickling a time bomb. India is having the maximum youth population of the world, but we are losing it silently and tragically of early heart attacks. अब उस मां का क्या, जिस मां का बच्चा रोते रोते उसके सामने चला गया, क्या हम उस मां के आंसू पहुंच पाएंगे? वो मां वो इस बच्चे को देख के रोज रोती है, उस मां के आंसू तो नहीं पहुंच पाएंगे, लेकिन हम कुछ अपने छोटे छोटे प्रयासों से काफी माओं के आंसू रोक सकते हैं. सो इंडिया, we have to fight for the generation, for the youth generation, क्योंकि हर दिल की कीमत होती है और हर मां का आंसू बहुत महंगा होता है. It is not a general health issue, it is a clinical emergency, it's a clinical blind spot. Thank you.